Hi, I'm Sofia Miller and I'm from San Francisco, California.
Hello, I'm Anna Socha and I'm from Seattle, Washington.
Hi, I'm Grace. I'm from Chicago, Illinois.
We are on a global gap year with Thinking Beyond Borders.
For our first unit, we've been studying public health in Plettenberg Bay, South Africa.
For the past 5 weeks, we've been following caregivers from non-governmental organizations, Hospice Plett, and that's it. I didn't say my last name, but it's fine. No one needs to know.
Working alongside the caregivers in Kurland was an incredibly impactful experience for me because I have dealt with chronic illness in my own life. I was sick for 4 years and my illness went undiagnosed, and the only reason that I was able to get better in the end is because of the incredible access that I was able to have and that I was fortunate enough to have, and because I had members of my family who were able to take care of me. And it's difficult to understand how important it is until you can really see the human-to-human contact and the relationship that the caregivers have with their patients.
In my experience with healthcare, I've seen how much of a toll it can take on someone to be a caretaker of a person with a chronic illness. When I'm working with these caregivers every day, I see how much support and care they're giving to their patients, and I'm wondering if they get the support that they need.
We have been partners with the Department of Health developing a home-based care program, which is a community-based service meeting the needs of those in their homes in impoverished areas in the context of a country that's got an epidemic, HIV epidemic, and other uncontrolled communicable diseases. Department of Health has arrived at the end of the year 2013-2014, which was March this year, having sort of made the decision that a comprehensive package of care and support, which is home-based care, which is what we do, was no longer required by the communities. But this left us coming into this year short of funding to implement our home-based care program, and it means that we have gone from having 234 patients in our care in March 2014 to today where we've got just over 90 who are receiving a comprehensive package of care and support.
It was very, very difficult because we used to be 3. I was alone at the beginning from 2004, and then we start with 2 people, and last year we were 3. So it became a little bit difficult because we had different patients with different circumstances or disabilities or illnesses. Last month I had a patient who passed away. She was only getting a disability grant for 2 months. She wasn't in a funeral policy. So somewhere, someone had to take care of it, and it became my responsibility.
Tamari, being a caregiver isn't just a job. It's a career through which she pursues a life that is dedicated to improving the lives of others. We often sit and just talk with patients and other community members to make sure that they're getting the emotional support that they need.
I'm not a nurse, I'm just looking after my mom, so I'm happy so that they check mama, because I don't have those machines for the high blood machine and the diabetes, whatever. They don't come in hospice. I need them. They don't come because my mom doesn't have a wheelchair. I wish I could take them all and build a shack here and put them all in here.
The normal things like bed washes, sit bath, pressure care, wound care, education, prevention and promotion, treatment adherence support.
It was in 2006. It hurt by my legs. It was painful. I was unhelpful. It was a big problem. Because I was only one time at the clinic, but they were not good. But they helped me. That means he was open. He was not strict. He gave me pulse. Sometimes when he is not there, he wasn't there. Help me with everything.
And when I started, I was sick. I didn't know I was sick because I started with the headache. And I take it like a flu. And I lose weight. And my weight going down, 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 down. One day came my auntie in my house and she take me to the clinic at the town and they test me there. And then they said to me, Lindy, I'm positive. And also my mother, she hates me. And my family, they hate me because of I'm positive. But I don't care about them. I don't care. No one is coming in my house and ask, how are you? How you feel today? What you want? No, I'm staying with my son in the house. We don't care. No one is looking after me. Just the home base and the clinic is looking after me.
So, because of scarcity of job, I'm working as a caregiver. But what I would like to be inside the clinic, helping people there. When we are doing a home-based care, you are not just doing it. You have also to encourage and and advise those people that we are visiting, so that they may see their sickness in other way, not because they are being stigmatized by other people around them. So we have to change that, so that if maybe someone is HIV or having any chronic illness, don't see that illness as a death sentence. So
As far as I'm concerned, they're nurses. They're not entry-level workers. They should be getting more than minimum wage. But there's a huge divide between what a nurse earns and what a caregiver earns. And yet the caregivers are doing the nursing.
Being a caregiver sometimes it gives more stress because you are dealing with people and you are helping people, but at the end you are just nothing, Yeah. Because I don't think the money that you are getting, it's some sort of the disgrace or embarrassment, because I don't think in our country no one can survive with that kind of money. So it's just sometimes you feel like sometimes a slave because you have to work very, very hard, But at the end of the day, nothing comes back to you.
Some treatment, I didn't want to drink my treatment. But the home base, they forced me. They come here in the house, they wash me, they give me tablets, they sit down and tell me what to do about my treatment. They come every morning, they give me my treatment and pap and porridge, everything. They cleaning my house, they clean my body, they do everything.
She helped me with everything. And every day.
He was a hero in my life.